Hi everyone, my name is Stephanie, and I'm going to be doing a presentation on schistosomiasis. Just a quick explainer, why did I choose this disease? I have a weird fascination with parasites, much to the chagrin of my friends and family, and noticed that we weren't doing a whole lot of parasite-borne diseases, so thought I would pick this one, especially because it has a lot of importance in terms of like world health. Because it affects quite a lot of people. And so I thought I would pick that. So let's get into it. So, just a brief introduction to the organism that causes schistosomiasis. The disease is caused by, they are trematode worms or blood flukes of the genus Schistosoma. Trematodes, you guys might be familiar with them. They are flatworms. A lot of them are not parasitic. For example, like the little flatworms that you probably dissected or looked at under a microscope in like an intro bio class. They're pretty cool. But the schistosoma guys are pretty unique in that most trematode species are actually hermaphroditic, but these guys are not, and we'll get into that in a little bit. There are two forms of schistosomiasis. There's an intestinal form and a urogenital form, and there are 5 species that cause the intestinal form and only one that causes the urogenital schistosomiasis. Most of these worms are native to the tropics and subtropic regions. So we've got Africa, the Middle East, the Caribbean, some in South America, so Brazil and Venezuela. You'll see the Schistosoma mansoni flukes. There are some, the Schistosoma japonicum, which are endemic to China, Indonesia, and the Philippines. And then the Mekonghi species as well is endemic to Southeast Asia. And then the one that causes urogenital schistosomiasis is only found in Africa and the Middle East, and that is Schistosoma haematobium. And if you look over to the right, there is a picture of a male and female adult schistosome worms of the Mansoni species. So like I said, there are 2 forms of the disease. There's intestinal schistosomiasis, which is generally marked by pretty nonspecific symptoms. So like abdominal pain, diarrhea, and bloody stool, which are unfortunately quite common to a lot of diseases, and so it's sometimes hard to diagnose. And then there's urogenital schistosomiasis, which the most common symptom of that is hematuria or blood in the urine. And it actually does have different symptoms in both patients with female anatomy and male anatomy. So in female patients, most commonly you're going to see vaginal bleeding, lesions in the cervix and the vagina, and nodules in the vulva. And for male patients, it's just generally inflammation of most of the reproductive organs. So in terms of impact, this is a pretty important parasitic disease because the only other one that has more impact on the world health is malaria. There's over 200 million people infected with schistosomiasis worldwide, and that is probably a pretty underestimated number. And it's also considered a neglected tropical disease, which these are listed diseases that are communicable, that occur in tropical and subtropical climates, and there's a bunch of them, and they affect over 1 billion people worldwide, and mostly in developing countries, and so they cost those developing countries a lot of money to deal with, and so there's actually a portion of the World Health Organization that is specifically targeted to the neglected tropical diseases. So there we have it. So if we get into the life cycle here of these flukes, all of them have, all of the species, like all 6 of them, have a very similar life cycle, and you might kind of recognize a little bit of it. It sort of looks like the life cycle of the liver fluke that we went over at the very beginning of class, with a few key differences. So in the life cycle, we've got at the very beginning schistosomes are known as muricidia. They are the little larvae, very small, that come out of the eggs that are deposited into fresh water. And so these muricidia grow. They emerge from the eggs, and then they grow a little bit in the water and swim into a freshwater snail host, which these snails are a very important part of the life cycle, and because they basically are a key host in terms of the development. So after the muricidia go into the snail, they will form sporocysts, which so they encyst into these little cysts inside the snail tissue, and they grow into cercaria inside of those sporocysts, which eventually those cercaria will leave the snail and go out into the freshwater. Those are another free swimming form. They have like a little, you can see at stage 5, there it has like a little pronged tail and a head, very distinct head, and they can survive in freshwater for up to 48 hours after they leave the snail, and then they will swim around and eventually find a human host. And then they will penetrate the human host's skin. Usually it's in feet, because a lot of the times people are wading in water to do laundry or to get water, or just to, like children in the water playing, and the cercaria will penetrate their skin essentially and make their way into that human's bloodstream. They will, as they're in the bloodstream, form into schistosomuli, which they lose their little tails and kind of travel through the human's blood to the blood vessels, where they will eventually grow into adult flukes. And the blood vessels are different for the different types of species. For the ones that cause intestinal schistosomiasis, those are the veins near the intestine, and then urogenital, those are the veins near the bladder. As in terms of the adult flukes, if you look at number 10, you can see kind of the male and female. What they do is when they grow into basically fully formed adult flukes, the male is a lot bigger, and he has like a little canal, is what they call it, in his abdomen, and the female is a lot skinnier, and she kind of like hangs out in that little groove for the entirety of their life as adult flukes, and they produce eggs, and then those eggs are passed out often into the host's body, not out of the body like they're supposed to be, and that's what causes the disease, but the eggs that make it out of the body are passed out into fresh water, and that is how that life cycle restarts. Fun stuff. Alright, so what we're looking at here is an electron micrograph of the male and female adult flukes. They are a pair. Most of the time they do essentially mate for life. It's very rare that they will leave each other. And so what we can see, the larger organism is the male fluke. You can see his little canal that the female sits in, down at the bottom left-hand corner of the picture, and you can actually see the female poking out from the very end of that canal. And then in between the female's head and the male's head is the ventral sucker, which is on the male's body, and he uses that to attach to the blood vessel wall. Okay, so moving on to the actual disease of schistosomiasis. So like we said earlier, in the life cycle, the cercariae enter the human body by penetrating the human's skin, which this, normally there isn't a reaction to that, but sometimes some people can get a small area of inflammation or like an itchy rash where the penetration site is. And then after that, you really don't know that you are infected with schistosomiasis until potentially 1 to 2 months after the infection. So some patients will develop fever, cough, chills, and muscle aches 1 to 2 months after that infection, and that is a result of the flukes maturing into adults and making their way down to the veins where they're going to hang out for the rest of their lives. That doesn't normally happen in most people, so most people still are not aware that they have the disease. So, like I stated earlier, the adult flukes will migrate to and remain in the veins closest to the exterior of the host. And so for those 6 species that cause intestinal schistosomiasis, these are the inferior mesenteric veins, which are connected to the small intestine, and the urogenital schistosomiasis species, they hang out in the venous plexus, which is around the ureter and the bladder. And so those are the veins that are closest to the outside of the human. So what causes the disease is that adult worms depositing eggs into the host organs, and the host's immune system responding to that egg deposition is what normally causes most symptoms. And most of the time, this affects children ages 3 to 4 years old. That is normally the first infection that they get, but because this is a disease that is really hard to get rid of, and it just kind of hangs out, basically. There's just like a lot of instances of this disease in the endemic areas, and so people get repeated infections throughout their lives, or they have an infection that just never goes away. So just kind of explaining the 2 different forms of schistosomiasis. The intestinal form, the main sites of the infection are the rectum, the sigmoid, and the descending colon. And so the symptoms here arise when eggs become trapped in either the mesenteric vein, the intestines, or when they travel potentially through the bloodstream to the liver, and that can happen sometimes, especially in really lengthy infections. So symptoms that you often would see in someone with this form of schistosomiasis are granuloma in organs, which those are caused by the eggs, and so like little granuloma form around the eggs, which causes abdominal pain, often bloody diarrhea, scarring of the tissues if you have a pretty intense infection, and then sometimes ulceration in the organs that are affected. And then in super advanced cases, if the eggs do make it to the liver can potentially become enlarged. And so in urogenital schistosomiasis, most often places affected are the bladder and the lower ureters, but in patients with female reproductive organs, the cervix, vagina, and vulva are also affected, and in patients with male reproductive organs, the seminal vesicles, vas deferens, and the prostate can be affected as well. So the most common symptom is blood in the urine, and normally that is blood in the terminal urine, but in a really either advanced or extreme case of infection, it can there can be blood in all of the urine. In female patients, usually you'll see lesions in the cervix, vagina, ovaries, and fallopian tubes, vaginal bleeding, nodules in the vulva, which are caused by egg deposition there, and also pain during intercourse, which is usually caused by all those lesions hanging out there. And then in male patients, the most common symptom is hemospermia, and in both male and female patients, there is a possibility of infertility. So female patients who have really advanced or extreme infections, often these are women in endemic areas who have had repeated infections or just have had an infection that hasn't been treated. They can develop female genital schistosomiasis, which is characterized by sandy patches or eggs in the genital tissue, usually in the cervix or vagina. This is caused by a chronic sustained infection of Schistosoma hematobium. In severe cases, there can often be an ectopic pregnancy and then heavy egg deposition in the uterus, during pregnancy. And then sometimes in these patients, they will have lesions and open wounds in the vagina and cervix, and there is the potential for an increased risk of transmission of sexually transmitted infections in these patients because of those open wounds. And that is often a big factor in, these women getting HIV, which is not good. All right, so getting into the epidemiology of schistosomiasis, transmission to humans happens when the cercariae penetrate the skin of a human that is in contact with contaminated fresh water. Humans are one host of the life cycle, but freshwater snails are the other host, they are a necessary part of the life cycle. If the Miracidia don't have a snail to insist within, then they are not going to form cercariae, and that fluke is not going to actually be able to complete its life cycle. There's at least 200 million cases worldwide, but that could potentially be an underestimate because the disease not only affects you when you first get it, but then it can also affect you throughout the rest of your life. And there are around 700 million people who live in the endemic areas, and so they are at risk of infection. The way you diagnose schistosomiasis is through testing urine or stool samples for the presence of eggs. And these types of tests aren't always conclusive because often there aren't a high level of eggs in the urine or stool samples, and so sometimes if you suspect that a patient has schistosomiasis, then a blood test could potentially be necessary, and you use that blood test to determine the presence of the anti-schistosomal antibody that the immune system generates when there is an infection. However, the blood tests sometimes are inconclusive because if someone has previously had a schistosomal infection, then that antibody is going to be present even if they don't have a current infection, and so you could get a false positive. So looking here, this is a map of the world, but also the shading indicates where the countries where schistosomiasis is endemic. Down at the key, you can see which countries have a high risk for intestinal or urogenital, it's endemic there and they have a lower risk, and then obviously the countries outside of that region, those regions aren't usually at risk of schistosomiasis. Sometimes people traveling into these endemic areas, though, are at risk, and so you can see cases cropping up outside of these countries. All right, so how are schistosomiasis and poverty linked together? So repeated infections of schistosoma parasites, as well as other parasitic infections, they are a high potential cause and effect of poverty in endemic areas. Most often, endemic areas of schistosomiasis are developing countries. So how are they tied together? Well, a high parasite burden in children can potentially lead to fatigue, malnutrition, and stunted growth. Often these kids, since they are tired, they don't play as often. They don't get as much exercise as kids who are uninfected, and then they also are more likely to miss school because of their symptoms, and so they score lower on tests and intelligence levels than children who are uninfected. This leads into adults who have been infected throughout their lives. They are typically weaker and have a smaller stature than those who haven't had repeated infections, and so they have a lower ability to perform well in labor-intensive jobs, which leads to a lower earning capacity. And so as these kids grow into adults in these areas and they have repeated or long-term infections of schistosomiasis, then they are most likely not going to be earning as much money as people who haven't been infected or don't have repeated infections, and so that negatively affects that individual, their family, and then also the country's economy as a whole, because there just isn't as much wealth being generated. And when I was researching, I read an article called Parasites and Poverty, the case of schistosomiasis, and it was really interesting. And I took away from it this quote: "The developmental transition from subsistence to cash economies requires both intellectual and physical skills that favor higher productivity." So in these countries where people are frequently infected by schistosomiasis, they aren't often being as productive both intellectually and physically, and so their economies are stunted and aren't growing at the rate that other economies across the world might be growing. So how are we going to treat and also prevent schistosomiasis in countries and areas that are endemic to these species? So there's only one form of medical treatment, and it's a chemotherapy drug called praziquantel. As of now, there aren't any documented cases of parasite immunity to the drug, so usually treatment is pretty successful once it's administered. Typically only one dose is necessary, but if somebody has a stronger infection or a higher parasite burden, another dose might be needed about 2 to 4 weeks later. One downside to this drug is it's only available right now in large pills, so it's a lot harder to give to younger children because as a kid it's hard to swallow something really big, and it's also hard to get them to take it, and so that can sometimes be a problem in eliminating infections in young kids. So not only can you use praziquantel to treat the disease, but also to prevent it, and so it's often given to young children, pregnant and lactating women, and then larger communities in endemic areas. And then the other form of prevention would be control of the local freshwater snail population. This is a more costly route in terms of prevention, but has been proven to be pretty effective because if you eliminate that host for the parasite, then that parasite is not going to be able to continue reproducing successfully. And so while it's more costly, it is probably quite beneficial in the long run to these areas, but also the world economy as a whole, because the people who have schistosomiasis could be contributing to the economy in greater numbers once those infections are under control. Other things, forms of prevention are availability of safe water for drinking, swimming, and then other things like doing laundry. That's important in those areas, and if these people don't have access to it, then they're just going to have to use what is available to them, and that's often the contaminated water. And then just like with anything, health education is also an important factor in prevention, but the most important things are treating and preventing through praziquantel, and then also controlling the freshwater snail populations. All right, so that is basically the end of this presentation on schistosomiasis. So we're here at the works cited page. If you are interested in it and want to do a little bit of further digging, I encourage you to read the Parasites and Poverty article. That was super enlightening in terms of schistosomiasis' effect on populations outside of its medical effect on them, because at least I don't often think about the economic effect of a disease, and so I think it was more humanizing, I guess, to see how widespread the effects of schistosomiasis are on world populations. So I thought that was really entertaining. But anyways, that is all for now. Thanks you guys for listening, and good luck on your exam.